got a good crowd today. How about that? How are you? Patrick Morrisey. Where are you from?
Here.
Where's
So I'm the president of the West
Okay, that's great. Yeah, well, thank you. Where are you from?
Martinsville.
Thank you. Thanks for coming in. Hey guys, good to see you. Hey Greg, good to see you. Good to see you. Nice to see you. What do we got here? Hey, where's Drew? Hey Drew, we got everyone here? Ready to go?
Yes, sir.
All right. Good. Thank you all for coming. Very much appreciate it. Come on, guys. This is a wonderful day today. We're going to talk a little bit about one of the most important initiatives that we're getting a chance to work on since I became governor about 8 months ago. Very exciting because we have a potential to help West Virginians out in a way that we haven't been given an opportunity before. You know, there was a lot of talk for a number of months about what's in the big, beautiful bill. A lot of talks about taxes and extension of taxes and tax cuts, and we certainly applaud. We want to applaud that. We want to see economic growth for our state and across the country. And there were a number of changes within various public programs that we're always looking at and trying to adjust to. But there's one provision that, quite frankly, hasn't received enough attention. And it's significant because it has an opportunity to distribute $50 billion over 5 years across all 50 states to strengthen rural health care. And the way they've set up this program, there's $25 billion that will be evenly divided among the 50 states. And then there's discretionary dollars as well that will be allocated to the states based upon the application that they submit, based upon the rural nature of the state, and also various policies that the states elect to pursue. That provides an unbelievable opportunity for West Virginia to, as I'm fond of saying, move the needle on things that really matter to help our state. And so we've been looking at these provisions for a number of months, and we've been talking with CMS, with various people within the agency, and now we're eager to work with the release of the application on Monday. We're eager to work with the Trump administration on an initiative that I think is going to benefit our citizens. I want you to think about this for a minute. If we submit a proposal that gets accepted, and I have confidence that that will happen, West Virginia is going to be receiving a minimum of $100 million per year over 5 years to focus on rural health care. Well, that's a minimum of $100 million. That by itself is really wonderful, and it has the potential to do a lot of good for West Virginians. But I want to go much further than that. I want to make sure that we're challenging our private sector to engage in matching, and I want this to really be truly transformational as the grant is described. I also want to make sure that we're putting our best foot forward to make a case to CMS that West Virginia is doing incredibly innovative work to move the needle, to improve those outcomes, and to make a real meaningful difference to rural health care in West Virginia, and if we succeed, across the country. We have a chance to get out in front and lead, and I'm really excited about this. So first of all, I want to thank President Trump. I want to thank our federal delegation. I want to thank RFK for his leadership at HHS, and CMS Administrator Dr. Oz, because I know I've had a number of conversations with him since he was nominated, and I know how much he cares about improving rural health and utilizing data to make a big difference for our country. So this Rural Health Transformation Program, I think it has the potential to be one of the biggest initiatives that you've seen us engage in. And I say that for a few reasons. We have a chance to help our citizens live longer, healthier lives. I've said this before, let's say it again. Maybe live a little bit longer, spend a little bit more time with family and friends, and focus on things that truly matter. We have an opportunity to reverse some of the terrible health trends that we've seen that have plagued our state for a long time. And I think the key to our application is to really go in and focus on things that we can meaningfully improve. You've all heard me say that it doesn't do any good to beat your chest about one win or another. What matters is moving the needle and going from 50 to 40 to 30 to 20 to 10 and beyond. And that's what we're certainly looking to do. But we know a lot of the challenges we have, whether we're talking about substance use disorder or diabetes or obesity or heart disease or many other different disease states, we have a chance to improve that. And that's because when we're looking at this project, we're not just looking at it from a pure healthcare perspective. That's part of the reason why we're going to structure the program the way we are within our office. This is something that will involve our health agencies. I'm very glad to be surrounded by our top cabinet talent here today in the healthcare arena. But it's also going to involve economic development. It could involve our energy, our technology folks, because there's so many different facets to this. When you're talking about improving outcome and gaining strength in rural areas, one of the most important things is to work and coordinate with companies in the business community and others and make sure that we have the right presence in those areas. Because when people have a good job and the economy is flourishing, that tends to make all the key healthcare indicators get better and better. So the way we're trying to help get this application together is to bring a lot of different parts in from within our administration to make this work. This is a challenge. We have an application is due on November 5th. That's a very aggressive schedule that the administration has given, and that's really why we're here today. We want to work hard within our administration, but we also want to reach out to the public at large. And I'm asking all the media who's here, I think a lot of people are here, and those who may not be here but are watching, we need to get the word out because we have to tap into the best knowledge and experience that West Virginia has. We have to develop the right strategy that is truly transformational and put together an application that will transform rural healthcare and quality, but also helps position West Virginia for greater economic success. I've always been a believer that in order to move the needle, lift up our standard of living, you have to focus aggressively on economic development. We're doing that. And we're working once again on the fundamentals to make that happen. I think this initiative provides us with an opportunity to really bring the best and brightest together. And I'm happy to see there are a lot of different groups represented here today. Yesterday I had a chance to sit down with a lot of the leaders within the hospital community. Last week I spent a little bit of time with WVU Health. I've talked with Marshall. There are a lot of different players who are going to get very, very engaged in it. And we want to meet with all of the constituencies out there. If you're a company and you care and you have different ideas, we want to meet with you. If you're a trade association, we want to meet with you. If you're part of the general public and have good ideas, we want to meet with you. We always are a believer in having that transparency and getting the good ideas and leveraging that to submit the best application. And one I think that can help bring everyone together. So we're really excited to make this happen. There are a number of things that we have to do in this application. We have to support innovation in rural areas and look at the root causes of disease to improve prevention, chronic disease management, behavioral health, and many other disease states. We have to help rural providers and new entrants improve the delivery of care in a way that ultimately moves the needle on outcomes. Very importantly, CMS and others, and we certainly want to do this, we want to make sure we're attracting and retaining the right workforce. That's a challenge. We've talked about the importance of moving our workforce participation numbers up, but we know in healthcare that's a big problem. In some of our rural and what are considered frontier areas, we have to do even more to bring the right array of people. Not just primary care physicians or specialists, but our advanced practice nurses and our physician assistants, our pharmacists, our techs, all these different areas. That's so important. We have to also spark the growth of innovative care models and different types of payment arrangements that improve quality, lower cost, and also help move the right type of healthcare to lower cost settings. I know that was one of the goals that the authors of this provision had in mind. They timed these provisions out that you could begin rural health transformation, and then they have a number of the changes in Medicaid. I want to make sure we're making progress as soon as possible. Then also CMS wants to rely heavily on technology, and I think this is also an incredible opportunity for us. How do we use technology to expand access to healthcare, to treat patients, to improve data sharing, and leverage all of the knowledge that we collectively have in our state to improve outcomes? You're going to hear me talk about that a lot. But with all that in mind, we are now looking for your input. And I'm asking you, and I'm asking the media of our state to also get the word out. I want to thank the people that have already been writing about this, because we do want your input. We want to make a difference here. Opportunities like this don't come along often, where you can be very strategic in terms of using these dollars, not just throw money on the wall and hope it's going to stick, but really leverage it. Bring the private sector involved. Get matching dollars coming out of the private sector. And to bring other industries where we're really strong. We have some different ideas about how energy can play an important role in this, and data and technology. But we do want your input, and there's limited time to make that happen. So if you're a legislator, if you're a healthcare provider, a pharmacy, a doctor, trade group, an employer, a nurse, a technician, or anyone in our state that could benefit from this program or have ideas about this program, please let us know. And we're providing information on our website. Tom, is that up on our website yet?
Yes, it is.
Okay, then we're going to give that information to you, and that's going to be helpful. But we need to have the statewide public comment period as a strategic priority. That's critical. Your input's going to be essential to develop the best possible application. Once again, if we do a good application, we might get the statutory minimum, which would be $500 million. I think we should strive for much more. Private sector and other leverage, whether it's state, local, private, or more federal, there are great opportunities. Let me take a moment and give our website. www.governor.wv.gov. That's www.governor.wv.gov. At the top, you're going to find something called Rural Health Transformation Program. There are going to be a set of questions, and you don't have to answer all of them. There are a lot of questions up there, but we'll just try to elicit your thoughts on this. Answer what you can, and think about it that if there are good ideas, we may be able to take and help carve and maybe put into our application. We're open-minded, but we're going to be weighing and evaluating everything that comes in. There are a set of questions that list, but you can email your responses to rhtp@wv.gov. So you can send in your responses to rhtp@wv.gov. I'm assuming through our website, that's all information that's up there. So we need your help now, and we would like that help in by September 29th. Why such an aggressive timeline? About 12 days away. That's because the application is due November 5th, and we have a lot of work to do. We have a lot of meetings to do, a lot of input, and then we have to put a winning application together. So that's why we're being aggressive here, and I want to say thank you to all those who have already submitted ideas and who will be submitting initiatives in the upcoming weeks ahead. Today, I'm also pleased to announce we have guests from across the healthcare industry, including representatives from the Pharmacists Association, WVU Medicine, the State Medical Association, Rural Health Association, the Center for Rural Health Development, the West Virginia Hospital Association, the West Virginia Office of Emergency Medical Services, folks involved in home care, West Virginia Primary Care Association, Marshall Healthcare Network, and then we have WVU Health Sciences Department, and of course we have folks from within our administration. I'm asking everyone in West Virginia, please get your comments in so we can submit a proposal that is best of its class by November 5th. I want to go in and I want to make the best case for our state, and we're best when we're united and we have the ideas that go through a good vetting process. So that's the big news of the day. I want to now turn it over to our wonderful healthcare leaders within our administration. We're going to start by giving Dr. Arvind Singh, Secretary Singh, a chance to say a few words.
Thank you, Governor Morrisey, and thank you for your leadership. Also, want to thank the Trump administration for making rural America a priority once again. This Rural Health Transformation Project, it's more than a federal program. It's a lifeline for West Virginia and our West Virginia residents. We all know the hard truth, as the governor mentioned. West Virginia ranks at the bottom of nearly every health metric, whether it's heart failure, whether it's infant mortality. But we're not here to dwell on those problems. We're here to seize the solutions, as the governor mentioned. This initiative gives us those resources, those needed resources, that flexibility, and the opportunity to chart our own future. We're going to use these dollars and this momentum to focus on a lot of the 4 pillars that the governor has already laid out. We're all familiar with those. So this is not about more bureaucracy. It's about unleashing common sense and accountability. I've mentioned accountability a lot, especially when it comes to the Department of Health and our grant process. With this program, West Virginia can finally turn that tide from being ranked at the bottom to becoming a national example of how rural states can innovate, save lives, and strengthen our communities. With President Trump's vision and Governor Morrisey's leadership, and the grit of all of us in this room and West Virginians, we can make this transformation real. Together, we will deliver stronger lives, healthier choices, and a better West Virginia. That's our new mission at the Department of Health. We're excited to be a part of this project and this transformation program, and we're eager to engage. We're looking for that feedback, as the governor mentioned, so please reach out. There's nothing but positive waves in the future for all of us. So thank you, Governor.
Thanks. And now we have our terrific Secretary of Human Services, Alex Mann.
Thank you, Governor. Similar to Dr. Singh, I want to thank the governor's leadership on this effort, as well as the Trump administration and their collaboration with the states in putting this forward. This is a true historic day. The opportunity for the state to leverage this type of funding to really move the needle and make West Virginia a leader in the state or in the country around these health outcomes. When I first got here, that was something that has continually been told to me, that we rank last in a number of areas. But with this infusion of funding from the administration and Governor Morrisey's leadership, we're really going to turn the tide there. I'm really confident in the team and those around the administration that we're going to take this opportunity, seize the day, and really move West Virginia to the forefront of health outcomes across the country. I look forward to the collaborative effort. I know this is going to be something that is going to involve a lot of different agencies, and I'm really looking forward to that effort. This opportunity just doesn't impact my agency or Dr. Singh's agency, but it spans a lot of different organizations across state government that are going to have meaningful impact and meaningful contributions to really assist the state in continuing to, as the governor said, move the needle and produce outcomes that we're proud of and are going to make ultimately West Virginians more healthy and able to thrive in this great state. So thank you, sir.
Yeah, excellent. Thanks. I do also want to let folks know that given the enormous challenge we have for this application and the importance of working with so many different people and cross-cutting through all the agencies of state government, we have retained an outside consulting firm, McKinsey, to assist us with this. We have a very tight window to get the application in, and so I appreciate that. We've been working, but I think it's important that we put every bit of focus and quality and resource to have the best possible application, and we need to win that application. We need to leverage. This is a great opportunity, not only in healthcare, but for economic development. That's a critical focus of our administration. There are a lot of people that are hurting out there. We know that we need to constantly be looking for better paying jobs. We need to make sure that we're addressing what ails people, the high cost of living in some areas. West Virginia as a state has historically been very strong from a cost of living perspective, but we saw a lot of inflation. That Biden era inflation, that hurt our state a lot. I want to keep doing everything I can to address all of the economic challenges that we have out there. And this is an opportunity for us to do a lot of meaningful, make a lot of meaningful progress on the economic front, in addition to the healthcare side. So I wanted to mention that to folks. So with that, I'd be happy to answer any questions from the media. Stephen.
Yes, Governor. You just mentioned the McKinsey contract. Do we know how much that's going to cost and where that's coming from as far as the funding?
I don't have an exact dollar amount right now, but we can work to get that to you. I know that we have resources that are important to deploy. I view this as investing money to help get a dramatic rate of return, because obviously this is not only, it's a $500 million application, so we have to be successful. And so we want to bring some additional expertise to bear. So, but we're happy to follow up with you with that.
And follow-up question too. I know you're a proponent of certificate of need repeal. I know it's been said a few times over the years that, particularly from the Hospital Association and others, that could have really an outsized impact on rural hospitals for sure, which are at risk of closing. It's part of the reason for this program in the first place, is in part to shore up those hospitals. So. Do you see any conflict between pushing for certificate of need repeal perhaps in the next legislative session and what you're trying to do with this application?
Look, it's no secret that I'm a big advocate of competition, and I think it can improve healthcare outcomes in our state. But I'm here today to focus on how we can all work together. You know, I think that there are a lot of opportunities, a lot of areas in common where we can actually bring different parts of the healthcare community together to advance progress. And, you know, we know that the application asks where you are on various policies in terms of licensure status and compacts and competition issues. So we're going to look closely at all these different types of issues. But I also want to use this as an opportunity to bring all the different people together because there's so much opportunity here. And I was having a good conversation yesterday about the importance of the healthcare workforce. And we're talking a little bit about some of the old Public Health Service Act, the scholarships, the loans and the grants of how people get recruited to rural areas and how we might be able to make that more durable, more permanent. Part of what I'd like to do is not have these funding cliffs. I abhor that. You know, this put my old policy geek hat on, right? That I hate these programs that go like this and then the funding drops off. I don't think that's being honest with people. That's part of what you saw with the budget discussions this year. We always talk about ongoing expenses matched with ongoing revenue. That's a more honest conversation with people. So I want to have all those conversations with the healthcare community. Obviously, you know, I continue to advocate for competition, but I'm also looking for a way to bring everyone together in this process, get the support we need. That makes a big difference. I have to let you ask a question.
I am going to write about this, so I have a question about this. I want to ask about BEAD,
Okay.
specifically the communities that are now left out of the application. What is your hope for the future for them?
So when you say communities left out, it's my understanding that what we've been trying to do is to target all the available locations that are eligible. And so that's what we've done. So we've tried to work in a collaborative manner because from the time that the locations were first identified to now, A, there might have been service within those communities. B, there may have been some other resources, some of it through some of the ARPA monies that we had actually announced. If I recall right, someone on my team correct me, but about $33 million or so that we announced a few months ago. I believe that's part of it, but I'm public, so I'm live, so I said don't quote me on that. But I don't want you to rely on the number. I want you to know that there are other things we're doing. So look, we're trying to service as many people as we can. And so we're always looking to do that. I think that our proposal will do that. And so we're being very aggressive. Obviously, the the way the law is designed, it's meant to focus on locations and where there are people now. There may be a time when more people come or move to those locations that we have to look at those opportunities. But it's a pretty fulsome application. And so obviously there were some changes made to accommodate some of the responses from the administration, and in a positive way. They're trying to save money. We like to save money. But look, we have a lot of work to do. We got to work with the administration, and I'm not going to stop until we get at least, let's start with those 74,000. I think that's really important. I applaud the Trump administration for working with us. But once again, I'm not going to do a victory lap until we actually get this all done, because I know there are all different ideas out there. I also want to take the opportunity, since you asked about BEAD, to note that there are resources we put in. I believe it's about $650 million, and there was the opportunity to get up to 1.2. I have hope that there are opportunities for us to tap into the unallocated dollars, whether it's for cellular, whether it's for other forms that facilitate broadband. We believe that is an opportunity for West Virginia, but we just haven't received the guidance yet on that front. So trust us that we're going to be very aggressive pushing for that to help our citizens out. And how that gets deployed, it's too early to say, because we need to make sure we're working with the administration on the guidelines they set up. So I'll be going in to have additional meetings with the administration in the upcoming weeks. And one thing you can count on is I'm going to be fighting and fighting and fighting tirelessly for West Virginia, and to make sure that our citizens get the benefit of all of the infrastructure opportunities that are available. Other questions from the media? WOWK? Wow, normally there's a question there. Stephen.
Well, I'll throw out another one, and it's going to be related to internet, but not BEAD. Obviously, telehealth is a growing thing in the healthcare industry. With a rural state, obviously, with BEAD, you are trying to get more people connected to the internet, more underserved areas, parts of the state. I know multiple things are going to be part of this application. If you see like a big pitch as part of the innovation package of this, trying to push for more access to telehealth and similar forms of healthcare to get access to people that might not be able to get to the hospital or the healthcare facility.
Without a doubt, I think telehealth has to be a critical part of our future. And I know during COVID, I was really probably one of the most aggressive ones pushing that. In fact, we had to work hard. I remember pushing hard to get some of the changes within some of the various boards to allow that to happen, because historically the state had limited some of those opportunities. Thankfully, that's been changing, which is great. But I think telehealth is one piece, but there could be a lot more as well. There's a lot of technology that's evolving right now, AI, virtual surgeries, and things like that we want to explore and look into, because I want to make sure that we improve access, and that could mean through traditional means, traditional providers, or new providers, new opportunities as well. So you're exactly right. This is a chance to really be very innovative. And I think part of the reason why we want to really partner with the private sector here and leverage those dollars is we want to create an incubator system that's going to tap into some of the newly available technologies. And that could be in telehealth. It could be in virtual surgery. It could be in really leveraging a lot of the data and AI opportunities out there. That's part of the reason I mentioned collaboration with technology and energy, because you got to fuel up the power for these centers as well. So I'm absolutely looking for that. I know our team is excited to pursue that. One thing I did want to mention, I hadn't mentioned earlier, it's a separate topic, but I know there's going to be a big vigil tonight as well. I don't know how many people will be there, but apparently a lot of folks are coming to it. I will be there speaking. I do want to honor the life of Charlie Kirk, and I think that's important. I just wanted to mention that we'll be at the Riverside at the Capitol. That event begins at 6 o'clock. I think I'll be down there around 6:30, 6:40 or so. I just wanted to mention that to anyone who's watching. Please come. It's an opportunity to, I think, celebrate the life of someone who was a friend of mine, but also I think stood strong for for free speech. And I'm a believer in that. I hope the media knows that in what these press conferences are all about. I don't run and hide behind the curtain. I don't think we need that in life. We need to be able to face the music. And what that guy did in debate and getting out in a public setting, I think we should all respect. That's a wonderful thing to cherish. So just wanted to mention that. Any other questions from the media? Well, I want to thank everyone for coming here. I want to especially thank the public in advance for anything that you might be willing to submit, and we'll be in close touch. Thank you. God bless.
Thank you.
Thank you. Appreciate it.